Hi everybody. Today I will be doing my New Jersey system presentation on the criminal justice system, and the component that I chose was reentry programs. So what exactly are reentry programs? Reentry programs are designed for people that are currently incarcerated that will be making their way back to the communities. So we want for these individuals to focus on old behaviors in order for them to develop pro-social behaviors and just to work on some of the challenges that are bringing them into contact with the criminal justice system in order for them to reintegrate more successfully in the program. And reentry should start as soon as an offender is incarcerated. So some important facts about the criminal justice system and the amount of people that are incarcerated. There are approximately 7.3 million adults that are incarcerated. So this doesn't even include the children that are incarcerated. Approximately 700,000 of those individuals will be returning home each year to their communities. And a number of these individuals will recidivate back to old behaviors and return back to the prisons. In New Jersey, according to the New Jersey Department of Corrections, there are 20,307 individuals that are currently incarcerated right now. So the importance of reentry programs is designed to assist individuals incarcerated. It helps individuals to have a better chance at successful reintegration. It helps to reduce recidivism. It helps to remove and reduce barriers to successful reentry. Helps to save money, and it breaks the cycle of drug use, crime. So reentry programs definitely work. They help to provide public safety by reducing recidivism, which is critical for increasing long-term public safety and lowering corrections costs. It helps with employment. Individuals who have been incarcerated can expect their future earnings to be reduced, but reentry efforts seek to reduce barriers to employment so that people with past criminal involvement, after they have been held accountable and paid their dues to society, of course, they can compete for work opportunities. It helps with health. Reentry efforts can help ensure that the Affordable Care Act and other reforms will significantly increase access to appropriate physical and behavioral health interventions after release from incarceration. I'm actually a liaison for my job in terms of getting people health care once they depart the program. It helps with education, which we know is a core resource for release preparation, and is also a critical building block for increasing employment opportunities. Reentry programs help with housing. The goal is to reduce barriers to public and subsidized housing and advance promising models that improve outcomes for people who repeatedly use corrections and homeless services. And also some of these individuals, they don't even have housing when they leave at all. So they will be returning back to the streets. So reentry programs help them to find stable housing. Reentry programs help on a micro scale, a meso scale, and it addresses these macro challenges as well. People have limited education and work experience in terms of that micro challenge. The meso, reentry programs help individuals to reconnect with their family members. And that macro challenge, which is, all of those collateral consequences that many individuals have on a legal scale. Reentry programs helps with that as well. What can be addressed? There are so many things that can be addressed through reentry programs. They can work on high-risk areas. They can receive educational and vocational training. They can go to different treatment programs to address their high-risk behaviors. They can rebuild relationships with their family, as I mentioned before. They can have individual counseling sessions. They can work on monthly treatment plans. They can build a social support system other than their family. They can have substance abuse interventions. They can address housing. And they can learn ways to live a conventional life and also address any trauma that they may have experienced, which we know people that have substance abuse challenges, some of them have experienced a lot of trauma in their life, which is why they've resorted to using drugs in the first place. So during the course of treatment, a client should or should not undertake to access these services when they feel like they won't be able to really complete the program. There are so many people that come out to reentry programs that's not really ready for change yet, which can be a huge issue for them, because if they do like certain things in a program, they can be returned back to close custody and face even more steeper penalties. And some people that's not really ready for change, they can go out in the community and they can escape, and that can add 3 to 5 years extra on their sentence. The people that should access these services are people that really want to make that change, people that are ready for change, people that's in that, preparation and action stage. So they're really, really trying. So ways to motivate clients to participate in reentry programs. We educate the clients about reentry programs. Some people don't know what a reentry program is. And we also explain the benefits of participating in a reentry program. So let them, tell them, you participate in a reentry program, you can address A, B, or C. You want to support the clients all the time. You want to help them throughout the process. And you want to be able to connect them to the necessary resources that your program might not have. And you also want to recognize the stage of change a client is in that I mentioned. So how do we support clients during the process? We be empathetic. We meet with them. We answer any of their questions that they have. And we also provide them with feedback that many people enjoy. Some people want that feedback. I know I love having feedback, and it's very important. So how can a client access service? They can go through seminars, through the Office of Community Programs. They have different representatives for different reentry programs who sometimes go out to the prisons and speak to the people that are incarcerated, and they tell them about, their programs and why they should come out to the programs. And they can also speak to the Office of Transitional Services, which also has representatives. Some people write to the Office of Transitional Services, especially when they are denied, and they can also mail it out. There are also some barriers for reentry programs. The previous behaviors in a prison or jail, some people have so many institutional infractions that they're denied to come to a reentry program. There's a waiting list. Many of the reentry programs get so full that some individuals never make it to reentry programs. Time, some individuals don't have enough time in the programs to address risky behaviors because they come to the programs and they're only there for a month or so. Medical challenges, some people don't clear to come to the program. Court hearings, clients that have court hearings sometimes have to go back to prison until matters are settled. Sometimes those matters don't get settled, so they can't even come back to the reentry programs. Temptations in the communities. Sometimes when they start working, job searching, going to school, they see those people, those places or things, and they start to engage in risky behaviors sometimes. Addiction is a stigmatized disease, not often regarded by the criminal justice system as a medical condition. As a consequence, treatment is not constitutionally guaranteed as a treatment of other medical conditions. So sometimes they don't really want to put in the proper resources into those reentry programs that's needed sometimes. And then there's staff challenges, for the drug involved offender, including, the lack of the resources, the infrastructure, and treatment staff, including physicians knowledgeable about addiction medicine required to meet the drug treatment needs of individuals under their supervision. Sometimes they just can't meet those needs. And because of that, people that have substance abuse challenges are not really getting the quality treatment that they need to successfully reintegrate back into society. So for the SUS clients, when it comes to all of those positive things that reentry programs can offer, reentry community-based drug abuse treatment can reduce drug use and drug-related criminal behavior. Medication assisted treatment is coming to reentry programs, which is huge. They can work on relapse prevention, develop relapse prevention plans. They can identify their triggers. They can identify different coping skills, and they can also participate in community meetings. So some of the laws and the criteria is a person has to be full minimum status to come out to a reentry program. They have to be within 24 months of their PD or max date. They have to have a positive psychological evaluation within the past year. They have to be medically cleared within the past year. They have to have a good institutional record. They must not have sex or arson offenses, which is definitely a barrier for some of these sex offenders because they're coming back out to the communities. Supervision is very helpful. We know that supervision helps individuals to stay on track. It helps them to avoid risk-taking behaviors. It helps when in terms, they have to take urine testing. Some people need supervision, to be successful. So in New Jersey, they have the Reentry Coalition of New Jersey, and their mission is to promote evidence-based principles that reduce offender risk through collaboration with community and justice partners, advocacy, education, and public policy development. They promote public safety through evidence-based systems of programs and services. They expand the array of quality intermediate sanctions. They develop cost-effective alternatives to incarceration in New Jersey. They build a network of organizations committed to improving community corrections, and they engage communities as part of the solution and not the problem. So meet Jen. She's a 34-year-old African-American female. She has no high school diploma. She has 2 children who she occasionally speaks to. She has some employable job skills. She has severe drug abuse history. She started using heroin at the age of 16. She has experienced trauma in her past. She has no family support currently, however, they are willing to speak with her, and this is her 3rd incarceration. She typically comes into contact with the criminal justice system to support her drug habit. Reentry program would definitely be beneficial for Jen. We can get her into the proper treatment program to address her substance abuse challenges as well as the trauma that she's experienced in her past. We can hook up with some parenting classes. We can get her into GED classes. We can also help her to reconnect with her family members, being that they are willing to speak with her. Her family will be able to come in every week and then 6 times a week if they really wanted to for visiting hours. This program would definitely be beneficial for a person like Jen because she can also work on her coping skills and those triggers. And this is where the reentry program would definitely work. Reentry. It's super, super important, very important. We want to stop the cycle, and one way to stop the cycle is by providing, these individuals with the necessary things that they need to make sure that they're able to live a conventional lifestyle. So some of the questions that I have for you guys In your opinion, what do you believe are some of the pros of an individual participating in a reentry program prior to their discharge from prison or jail? And can you think of any cons to an individual participating in a reentry program? The second question, what do you believe needs to be done, if anything, for individuals participating in a reentry program that have substance abuse challenges soon to be released from prison? And this is the end of my presentation. Thank you for watching. Have a great day.